In general, you can divide these vascular procedures into two broad camps. There's the arterial side and the venous side. The venous side has to do mostly with varicose veins and the problems that come from varicose veins. The kinds of procedures that we do in the office involve treatment of specific varicose veins, either by injection or removal, or very commonly we'll treat what's really the underlying problem that causes the venous disease, and that is by various means we'll treat what we call reflux in a vein, and that refers to the backwards flow of the vein. Normally the venous flow will go from the foot up towards the heart, but in certain circumstances that blood flow doesn't get out of the leg as efficiently, and in fact can even travel the wrong direction, and that's called reflux, and that causes pressure inside the veins, which then leads to the varicose veins. So you can treat individual varicose veins, but if you don't deal with that underlying reflux, they're always going to come back, or your initial procedure won't be, as successful for the patient. So the bad actor in most cases is a vein called the greater saphenous vein. It runs down the middle of the leg, and it's a superficial vein. It's just under the skin. It connects to the deeper veins up at the top of the leg in the groin, and that's the vein that most commonly has insufficiency, has leaky valves. And so from a sort of pathophysiology standpoint, the blood is moving up out of the legs, just not as efficiently as it needs to for normal venous circulation. And some of the venous blood will reflux back down from the top of the leg into that saphenous vein. So you end up having kind of almost a recirculation effect of venous blood, and that ultimately causes increased pressure inside the veins. So because our veins have valves in them, an individual segment of a vein might have a pressure of only 10 or 15 millimeters of mercury, comparing that to like a systemic blood pressure of 120. So it's much less than your arterial blood pressure. But if those valves don't work and you have that insufficiency, that pressure goes way up. It might be 50, 60, 70 or higher. And so the veins are not designed to handle that kind of pressure. And because of that, it forces its way out, the pressure does, into small veins under the skin and become big veins under the skin. And those are what you see as varicose veins. So when we're treating that, oftentimes we're not treating those specific veins that you see or even that hurt, but we're trying to treat that underlying saphenous vein that's the problem. If we close off that saphenous vein, we eliminate that high pressure flow in that vein. Well, all those big varicose veins that are branched off of the saphenous vein, they tend to decompress, flatten out, go away, or at a minimum, they don't bother you anymore. With venous diseases and varicose veins, there's a temptation to think that this is primarily a cosmetic issue. And certainly, there are people who are concerned about, the appearance of varicose veins, or the little spider veins are called telangiectasias. But we primarily deal with the medical side of it, and the underlying problems that often cause those varicose veins. I've talked before about reflux and the backwards flow, a high pressure flow of blood in the veins, and patients will experience that in many different ways. It can be just a sense of heaviness or fatigue in the legs. You can have itching, burning, fatigue, pain, throbbing, sometimes swelling. Sometimes individual varicose veins will, like this vein right here on my calf hurts if I'm on my feet for more than an hour. Sometimes it's just a generalized sense of things. But it's not just a cosmetic issue. It's a real medical problem, and left untreated, these problems can progress over time as that high pressure, venous insufficiency takes its toll. It can begin to put increasing pressure on the skin down the lower leg, particularly around the ankle. You can start to have skin changes where you'll get darkening of skin, thickening of the skin, and then eventually it can break down into ulceration, where you have an open wound. Now you've got a wound to heal. I think the key takeaway for me is that people who are having these symptoms we want the public to be educated that they exist, and maybe they don't like how they see varicose veins, and oh, well, that's just a cosmetic thing. But think about if you're experiencing any of those other problems as well, because if that's the case, then that really does suggest some underlying venous pathology, and in many cases we can deal with that quickly, easily, and efficiently in the office, and set you up for a much better outcome down the road. The venous office-based procedures, really, we've been doing those for 20 years or more, going back to even before the medical pavilion was built. And although when I was in training, we did these in a hospital setting, but of course I was in a hospital training environment. And when I came to Cedar Rapids, I immediately saw the utility of moving these procedures into the office, and that it was very feasible, and the patients were comfortable, and so that was an easy transition. People often ask, well, don't you need that vein? Well, ideally, it'd be nice, but you have to understand that that vein is not functioning properly, and in fact, it's making the venous circulation worse in your legs. So, if the vein were normal, well, sure, I think it's a useful part of the normal venous circulation. But as things stand in these patients, the vein is causing problems, and in fact is making everything worse. And so the normal veins, the large veins inside the leg, inside the muscle, what we call the deep venous circulation, there's more than enough horsepower, in those veins to adequately, serve the venous circulation once you've treated that saphenous vein.